Hello, everyone. I'm Small Town Voice. Regarding the origin of the COVID-19 has been a big topic in China for obvious reasons, because it seems like in the Western world, they blame China for the breakout of the COVID-19. And in China, most people do not believe that's the case. In fact, many people believe China is the victim of the biochemical warfare initiated in the United States targeted to China. So exactly what happened, we might never know, but recently there has been a speech by Dr. David Martin in the European Parliament International COVID Summit, got the attention again regarding the COVID-19 origin. Does that answer the question of the origin of COVID-19? Let's have a look. Here's the website that you can find his speech. If you go to the website for the European Parliament International COVID Summit, and you click here, that's all the speakers, you can hear them all. And his speech, Dr. David Martin's speech, is around 13 minutes, somewhere there. Now, who is the Dr. David Martin? This is his website, his company's website, the MCAM. He's the head of the MCAM. And you can find some information. It's very quickly. Dr. David Martin funded MCAM in 1998 and has served as its CEO and the chairman since that time. MCAM has been an international intangible asset underwriter and analyst firm, spanning work in innovation, finance, trade, and intangible asset finance. So basically, he's a financial analyst. And the company seems to me like doing analytical work for financial institutions and for asset management, etc. So that's who he is. And clearly he was invited as a speaker, so he must have some experiences in this area. And I just downloaded his whole speech, and here is what he said.
It is a particularly interesting location for me to be sitting today, given that over a decade ago, I sat in this very chair right here in the European Union Parliament. And at that time, I warned the world of what was coming. During that conversation that was hosted at the time by the Green and EFA and a number of the other parties of the European Union's various representations, we were having a conversation on whether Europe should adopt the United States policy of allowing for the patents on biologically derived materials. And at the time, I urged this body, and I urged people around the world, that the weaponization of nature against humanity had dire consequences. Tragically, I sit here today with that unfortunate line that I don't like to say, which I told you so. But the fact of the matter is, we're here not for a reprisal on past decisions. We're here to actually, once again, come to the face of the human condition and ask the question, who do we want to be? What do we want humanity to look like? And rather than seeing this as an exercise in futility, which is very easy from time to time when you're in the position I'm in, I actually see this not as an exercise in futility. I see this as one of the greatest opportunities that faces us, because we now have a public conversation, which is now front and center in people's minds. When this was an esoteric conversation about biological patents, nobody cared. But when that conversation came home, then it became something people can care about. So I'm actually quite grateful for this opportunity. I thank the members of Parliament for hosting this. I thank all of the translators who, I apologize in advance. I will use terminology that is probably very difficult to translate, so my apologies. And I'd also like to acknowledge the fact that many of you are aware of my involvement with this, in large part due to the amazing work of my wonderful wife, Kim Martin, who encouraged me at the very early days of this pandemic to get on front of the camera and talk about all the information that I had been sharing among very small groups around the world. And it was, in fact, her encouragement that put me in a place where many of you have heard what I have to say. Ironically, the world that I came from, that used to be very popular, my CNBC and Bloomberg presentations, which were televised on mainstream media around the world, was an audience that I lost. I can confidently say COVID diminished my fame. But I can also confidently say that I'd rather stand among the people with whom I'm standing today than any of the folks that were part of that previous world. So this is a much better place to be. My role today is to set the stage for this conversation in a historical context, because this did not come in the last 3 years. This did not come in the last 5 or 6 years. This actually is an ongoing question that probably began here in Europe in the early stages of the mid-1900s, but certainly by 1913, 1914, this conversation started right here in Central Europe. The pandemic that we alleged to have happen in the last few years also did not happen overnight. In fact, the very specific pandemic using coronavirus began in a very different time. And we'll try to advance the slides here with one of these things. Oh, there we go. Most of you don't know that coronavirus as a model of a pathogen was isolated in 1965. Coronavirus was identified in 1965 as one of the first infectious replicatable viral models that could be used to modify a series of other experiences of the human condition. It was isolated once upon a time associated with the common cold. But what's particularly interesting about its isolation in 1965 was that it was immediately identified as a pathogen that could be used and modified for a whole host of reasons. And you heard me correctly, that was 1965. And by the way, these slides are public domain. You're welcome to look at every single reference. Every comment that I made is based on published material. So do make sure that you look at those references. But in 1966, the very first COV coronavirus model was used as a transatlantic biological experiment in human manipulation. And you heard the date, 1966. I hope you're getting the point of what I'm saying. This is not an overnight thing. This is actually something that's been long in the making. A year before I was born, we had the first transatlantic coronavirus data sharing experiment between the United States and the United Kingdom. And in 1967, the year I was born, we did the first human trials on inoculating people with modified coronavirus. Isn't that amazing? 56 years ago, the overnight success of a pathogen that's been 56 years in engineering. And I want that to chill with all of you. Where were we when we actually allowed, in violation of biological and chemical weapons treaties, where were we as a human civilization when we thought it was an acceptable thing to do to take a pathogen for the United States and infect the world with it? Where was that conversation? And what should have been that conversation in 1967? That conversation wasn't had. Ironically, the common cold was turned into a chimera in the 1970s. And in 1975, 1976, and 1977, we started figuring out how to modify coronavirus by putting it into different animals, pigs and dogs. And not surprisingly, by the time we got to 1990, we found out that coronavirus as an infectious agent was an industrial problem for two primary industries, the industries of dogs and pigs. Dog breeders and pigs found that coronavirus created gastrointestinal problems, and that became the basis for Pfizer's first spike protein vaccine patent, filed, are you ready for this, in 1990. Did you hear what I just said? 1990. Operation Warp Speed? I'm sorry. Where's the warp and the speed? Pfizer, 1990, the very first spike protein vaccine for coronavirus. Isn't that fascinating? Isn't it fascinating that we were told that, well, the spike protein is a new thing. We just found out that that's the problem. No. As a matter of fact, we didn't just find out it was not just now the problem. We found that out in 1990 and filed the first patents on vaccines in 1990 for the spike protein of coronavirus. And who would have thought? Pfizer. Clearly the innocent organization that does nothing but promote human health. Clearly Pfizer. The organization that has not bought the votes in this chamber and in every chamber of every government around the world. Not that Pfizer. Certainly they wouldn't have had anything to do with this. But oh yes, they did. And in 1990, they found out that there was a problem with vaccines. They didn't work. You know why they didn't work? It turns out that coronavirus is a very malleable model. It transforms and it changes and it mutates over time. And as a matter of fact, every publication on vaccines for coronavirus from 1990 until 2018, every single publication concluded that coronavirus escapes the vaccine impulse, because it modifies and mutates too quickly for vaccines to be effective. And since 1990 to 2018, that is the published science, ladies and gentlemen. That's following the science. Following the science is their own indictment of their own programs that said it doesn't work. And there are thousands of publications to that effect, not a few hundred, and not paid for by pharmaceutical companies. These are publications that are independent scientific research that shows unequivocally, including efforts of the chimera modifications made by Ralph Baric in the University of North Carolina, Chapel Hill. All of them show vaccines do not work on coronavirus. That's the science. And that science has never been disputed. But then we had an interesting development in 2002. And this date is most important because in 2002, the University of North Carolina, Chapel Hill patented, and I quote, an infectious replication defective clone of coronavirus. Listen to those words, infectious replication defective. What does that phrase actually mean? For those of you not familiar with language, let me unpack it for you. Infectious replication defective means a weapon. It means something meant to target an individual, but not have collateral damage to other individuals. That's what infectious replication defective means. And that patent was filed in 2002 on work funded by NIAID's Anthony Fauci from 1999 to 2002, and that work, patented at the University of North Carolina, Chapel Hill, mysteriously preceded SARS 1.0 by a year. Dave, are you suggesting that SARS 1.0 wasn't from a wet market in Wuhan? Are you suggesting it might have come from a laboratory in the University of North Carolina, Chapel Hill? No, I'm not suggesting it. I'm telling you that's the facts. We engineered SARS. SARS is not a naturally occurring phenomenon. The naturally occurring phenomenon is called the common cold. It's called influenza-like illness. It's called gastroenteritis. That's the naturally occurring coronavirus. SARS is the research developed by humans weaponizing a life system model to actually attack human beings. And they patented it in 2002. And in 2003, giant surprise, the CDC filed the patent on coronavirus isolated from humans in violation, once again, of biological and chemical weapons treaties and laws that we have in the United States. And I'm very, very precise on this. The United States likes to talk about its rights and everything else and the rule of law and all the nonsense that we like to talk about. But we don't ratify treaties about, I don't know, defending humans. We conspicuously avoid that. We actually have a great track record of advocating for human rights and then denying them when it comes to actually being part of the international community, which is a slightly problematic thing. But let's get something very clear. When the CDC in April of 2003 filed the patent on SARS coronavirus isolated from humans, what did they do? They downloaded a sequence from China and filed a patent on it in the United States. Any of you familiar with biological and chemical weapons treaties knows that's a violation. That's a crime. That's not an innocent oops. That's a crime. And the United States Patent Office went as far as to reject that patent application on 2 occasions until the CDC decided to bribe the Patent Office to override the patent examiner to ultimately issue the patent in 2007 on SARS coronavirus. But let's not let that get away from us, because it turns out that the RT-PCR, which was the test that we allegedly were going to use to identify the risks associated with coronavirus, was actually identified as a bioterrorism threat by me in the European Union-sponsored events in 2002 and 2003, 20 years ago. That happened here in Brussels and across Europe. In 2005, this particular pathogen was specifically labeled as a bioterrorism and bioweapon platform technology. Described as such. That's not my terminology that I'm applying to it. It was actually described as a bioweapons platform technology in 2005. And from 2005 onwards, it was actually a biowarfare enabling agent, its official classification from 2005 forward. I don't know if that sounds like public health to you. Does it? Biological warfare enabling technology. That feels like not public health. That feels like not medicine. That feels like a weapon designed to take out humanity. That's what it feels like. And it feels like that because that's exactly what it is. We have been lured into believing that EcoHealth Alliance and DARPA and all of these organizations are what we should be pointing to, but we've been specifically requested to ignore the facts that over $10 billion have been funneled through black operations through the check of Anthony Fauci and a side-by-side ledger where NIAID has a balance sheet and next to it is a biodefense balance sheet equivalent dollar-for-dollar matching that no one in the media talks about. And it's been going on since 2005. Our gain-of-function moratorium, the moratorium that was supposed to freeze any efforts to do gain-of-function research. Conveniently, in the fall of 2014, the University of North Carolina, Chapel Hill received a letter from NIAID saying that while the gain-of-function moratorium on coronavirus in vivo should be suspended, because their grants had already been funded, they received an exemption. Did you hear what I just said? A biological weapons lab facility at the University of North Carolina, Chapel Hill, received an exemption from the gain-of-function moratorium so that by 2016, we could publish the journal article that said, SARS coronavirus is poised for human emergence in 2016. And what, you might ask, Dave, was the coronavirus poised for human emergence? It was WIV1, Wuhan Institute of Virology Virus 1. Poised for human emergence in 2016 at the proceedings of the National Academy of Sciences, such that by the time we get to 2017 and 2018, the following phrase entered into common parlance among the community. There is going to be an accidental or intentional release of a respiratory pathogen. The operative word, obviously, in that phrase, the word release. Does that sound like leak? Does that sound like a bat and a pangolin went into a bar in the Wuhan market and hung out and had sex, and lo and behold, we got SARS-CoV-2? No. Accidental or intentional release of a respiratory pathogen was the terminology used, and 4 times in April of 2019, 7 months before the allegation of patient number 1, 4 patent applications of Moderna were modified to include the term accidental or intentional release of a respiratory pathogen as the justification for making a vaccine for a thing that did not exist. Keep going. If you have not done so, please make sure that you make reference in every investigation to the premeditation nature of this, because it was in September of 2019 that the world was informed that we were going to have an accidental or intentional release of a respiratory pathogen so that by September 2020, there would be a worldwide acceptance of a universal vaccine template. That's their words, right in front of you on the screen. The intent was to get the world to accept a universal vaccine template, and the intent was to use coronavirus to get there. And the last slide. This isn't advancing, so if I could have somebody do it. Let's read this, because we have to read this into the record everywhere I go. Until an infectious disease crisis is very real, present, and at the emergency threshold, it is often largely ignored. To sustain the funding base beyond the crisis, he said, we need to increase the public understanding for the need for medical countermeasures such as a pan-influenza or pan-coronavirus vaccine. A key driver is the media, and the economics will follow the hype. We need to use that hype to our advantage to get to the real issues. Investors will respond if they see profit at the end of the process. Sounds like public health? Sounds like the best of humanity? No, ladies and gentlemen, this was premeditated domestic terrorism stated at the proceedings of the National Academy of Sciences in 2015, published in front of them. This is an act of biological and chemical warfare perpetrated on the human race, and it was admitted to in writing that this was a financial heist and a financial fraud. Investors will follow if they see profit at the end of the process. Let me conclude by making 5 very brief recommendations. The last slide. Nature was hijacked. This whole story started in 1965 when we decided to hijack a natural model and decide to start manipulating it. Science was hijacked when the only questions that could be asked were questions authorized under the patent protection of the CDC, the FDA, the NIH, and their equivalent organizations around the world. We didn't have independent science. We had hijacked science. And unfortunately, there was no moral oversight in violation of all of the codes that we stand for. There was no independent, financially disinterested, independent review board ever impaneled around coronavirus, not once. Not once. Not since 1965. We do not have a single independent IRB ever impaneled around coronavirus. So morality was suspended for medical countermeasures. And ultimately, humanity was lost because we decided to allow it to happen. Our job today is to say, no more gain-of-function research, period. No more weaponization of nature, period. And most importantly, no more corporate patronage of science for their own self-interest unless they assume 100% product liability for every injury and every death that they maintain. Thank you very much.
There are 2 things that stand out in his speech. One is 1990, Pfizer already has a COVID vaccine. Okay, it's a different technology, it's not mRNA, but it is very clear since then until 2018, it is well recognized fact in the academia world, in the science world, that the vaccine doesn't work. It doesn't work because COVID virus is changing and mutating too fast. So the vaccine simply cannot catch up. That's one thing that's widely recognized in the academia world, in the science world. The other thing is what he said that shocked me a little bit is SARS is produced in the lab. SARS is another type of coronavirus. And according to him, it is manufactured in North Carolina Chapel Hill lab. Now, how did that come to China? It's not clear. It's not just China, but other Asian countries were suffering from the SARS in 2003. But that's not a naturally occurring virus, the SARS virus. He did mention a couple of times the Wuhan Virology Institution. Based on my reading, Wuhan Virology Institution has participated some, but it's very minimal. The role of the Wuhan labs participation is very minimum. All the patent, all the labs works, most of them are done in the US simply because US is more advanced in this area. Now, China was interested in participating in this kind of research. That's not surprising because China experienced SARS in 2003. So since then, China certainly want to learn more about the coronavirus, about vaccine, etc., these kind of topic. And when the US, when Dr. Fauci decided, he got the funding and he decided to do these kind of research, and probably intentionally he would like to do it overseas because the controversial nature of this kind of study, it is a violation of the biochemical treaty, which was signed in 1925. So since then, the US has been conducting this kind of research, in particular gain of function, is very controversial. So for Dr. Fauci to trying to find partners in other countries, that's not surprising. I would guess it's probably more than just China. But because China had SARS virus, so China could contribute for data. And that's one thing that China did was when CDC filed the patent in 2003, China did provide a sequence. So that's one role that China played. The other thing he brought up about the Wuhan lab is the 2016, there is an article apparently already predicted that SARS coronavirus will appear again in human. And there's a name, it's called the WIV1, Wuhan Institute of Virology 1. Now, again, that's not surprising at all. If the data are coming from China, from Wuhan possibly, then they named the virus after the origination, the location of the data. I don't find that so surprising at all. So it seems to me that the Wuhan Institute of Virology has some role to play here, but a very minor role. That's my takeaway from his speech. Now, on top of that, I find some interesting articles myself. For example, this one. This one is saying that Spanish study showed that the sewage samples from March 2019 has been traced that has COVID-19 antibodies in there. Here's another one about Italy, that Italy's coronavirus appeared earlier than they thought. And this is based on some cancer research. They have volunteers for a lung cancer study, and those volunteers, they must have left some blood samples or urine sample or some kind of samples that Italy did some testing and noticed, and it showed that some of their patients has coronavirus antibodies as well. So that can be tracked to September in 2019 in Italy. Similar studies and articles also. This one is saying US blood samples collected in December of 2019 shows COVID-19 antibodies. What does it mean? And if you read it here, it says the novel coronavirus that ignited the pandemic has struck US citizens in mid-December 2019, according to a recent study. Analysis of blood specimen from over 20,000 Americans showed evidence that the virus had already infected people weeks prior to identification in China, and more than a month before public health authorities reported the first US cases. So you see, there's study even in the US also indicated that it came to US before it showed up in Wuhan. And here's another one, a similar study about blood samples, and this is the blood donation that they find also antibodies earlier than for patients that they have samples from December 2019 to January 2020 that they find antibodies in their samples as well. One more article I find is on the expose. On their website, here's what it says, that US Department of Defense issued a contract for COVID-19 research in Ukraine 3 months before COVID was known to even exist. What it mainly showed is a spending record. And here you can see, I did a screenshot to make it easier to enlarge. And here on this line, it's a spending record by the DoD. And here in 2019, November 12th, this company is called the Labyrinth Global Health. So this company has been getting paid for around $370,000 and to conduct SME manuscript documentation, and COVID-19 research. Yeah, it is kind of odd, isn't it, that in November, which nobody knows, there was a COVID-19 existed, the DoD already hiring companies to do some work, COVID-19 research. So what does this all mean? Based on my collection, my reading, so here are a few things. Like in March 2019, new coronavirus found in Spanish sewage samples. And then September is in Italy, is where the cancer patient, lung cancer patient volunteers, that their samples show that there's antibodies. And here the significant one is the November 12th, 2019, the US Department of Defense awarded a contract for COVID-19 research in Ukraine. And follow that is December 1st, being regarded the official breakout of the COVID-19 is in Wuhan is December 1st. But as you can see, a lot of things already happened before November 1st. The other thing China got a lot of blame is for saying China has been secretive, etc. But actually in 2020, January 10th, less than 1.5 months after the breakout, the Chinese scientists published a draft virus genome, which is very important for further studies, including vaccines. And China just shared it with the world for free. So I just want to bring that out. And then in 2020, February 11th is officially named COVID-19. But like I said, in November is the Department DoD already awarded contract for related studies, right? Research. Okay, so what does this all mean? What it means is that we may never know the origin of COVID-19. Think about it, because COVID-19 is a new virus and its symptom very much like a common cold. So when it first appeared, most likely whoever has it might not even aware because there's no symptoms possibly, or just very minor, the person will most likely think it's a flu. That's more reasonable, right? But why does it, by the time it discovered in Wuhan, possibly by the time it get to Wuhan, it mutated to a stronger virus, the symptoms are more clear. On top of that, China also had SARS in 2003, which is another type of coronavirus. So China is more aware and more alert in terms of related diseases. There was a very short period of time that the rumor was Wuhan had SARS for that reason, because it is already clear to the Chinese authorities that it's not common flu. And they were immediately thinking that it could be SARS. So that's why there was a rumor there. But then they quickly noticed it's not even SARS. It's a totally new virus. It's related, it's another type of coronavirus, but it's not SARS, it's not common cold. And that's when they discovered, okay, so here's a whole new virus that is going on. That's more reasonable, right? The very first patient immediately got discovered. That's not very likely. It's more likely that it has been going on circulating somewhere in the world, and then it get to Wuhan and it's discovered in Wuhan, possibly mutated also in Wuhan into a different type. And that's more likely to be what happened. So the conclusion is, based on all my reading and Dr. Martin's speech, is US has been conducting this type of research for a long time, since 1965, against biochemical treaty, against the biochemical weapon treaty. And it has made some breakthroughs. Obviously, they have applied and being awarded different patents related to that. And Pfizer actually even had its own vaccine in 1990 against the coronavirus, right? So nothing new in terms of in the scientific world for what happened. Now, China's involvement, like I mentioned, is minimal because China had SARS. So China is eager to learn something more about coronavirus and working with the United States, that's not surprising. And in the process, China provided sequence and provided data. That's what China's involvement, China's role, the Wuhan Institute of Virology's role. And it's very minimal. So the origin, we don't know. We may never know. But it is pretty clear to me, it's not started in China. It is discovered in China. And China did all it could to share the information, including the genome sequence with the world for free as soon as it can. So stop blaming China, okay? And like I said, and many of the people in China actually do believe this is an asserted effort by the US targeting China. That's lots of people in China believe. There's no evidence of that. I haven't seen any evidence of that, but that's the sentiment with some people in China. I'm sure this topic will continue to be discussed in China, around the world, but seems to me it is safe to say it's not originated in China. It is discovered in China. Thank you. That's all for now. If you like my program, please hit the like button and subscribe. Thank you.